Here is the simple squamous epithelium, which is attached to the myocardium by both loose and dense in this case. And that would be the visceral pericardium. That would be this layer right there, okay, attached to the heart. What I'm touching, when I open this up, when I'm touching the surface of the heart, that would be the visceral pericardium, and I'm touching simple squamous epithelium. Then it curves back on itself, and I'm exaggerating the space. Still simple squamous epithelia, but now the connective tissue is on the outside, facing outside, attaching it to the diaphragm. If this is a lung, it would attach it to the chest wall, okay? So this is now the parietal. Pericardium, what we see out here. Okay, and inside would be the pericardial cavity where the serous fluid is. So far, this is exactly like we see with the lungs and with the abdominal organs. However, so here would be visceral pericardium, smooth, simple, squamous epithelia, connective tissue. But notice that outer layer, the parietal pericardium, has an extra layer of connective tissue. That is for the purpose of preventing the heart from filling up with too much blood. Because remember, the heart is a muscle. Now, if the lungs fill up with too much air, they can rupture certain alveoli, and we have receptors that prevent you from taking in too much air. But if the lung fills up with too much blood and expands, remember the muscles have actin and myosin in them. So if we stretch those muscle cells and the actin and the myosin no longer overlap, what happens to our ability to contract, for myosin to pull on the actin? We lose it, part of it or all of it, if it stretches too far. So to prevent the heart from overstretching, an additional layer of connective tissue is added to the outside. And this is dense, irregular connective tissue on the outside. All the way around, all right? So our parietal pericardium actually has two components, and that's where it becomes confusing. So like the uterus, we have pericardium, perimetrium, myocardium, myometrium, endocardium, endometrium. But the uterus doesn't have this extra layer out here, okay? So the parietal pericardium has two components. So in black is the fibrous component. So we call this the fibrous parietal pericardium. And the inner component, the connective tissue and simple squamous epithelium that's making our serous fluid, is called the serous parietal pericardium. Now when I talk about this in the wintertime, I usually have a sweater on, and I did this morning, but it's got too hot to wear the rest of it. But if you imagine me, thank you for volunteering. May you be my heart, please. Do you mind coming up? I'm going to use your jacket.
Me?
Yes, you. Yeah. Okay. So keep a heart. Okay. This jacket is the parietal pericardium. The outside part is the, you're not going to miss this on the test, right? Because you're going to is the fibrous parietal pericardium. And let's say the lining, let's say it's a silk lining. That's going to be the serous parietal pericardium. And then if he was wearing a silk shirt, that would be the visceral serous pericardium. Okay? And his body, his skin would be the actual myocardium. So if that lining was continuous, we'd have fibrous parietal, serous parietal, and then visceral serous. Okay, and fluid would be between the two. Thank you. So back to the plastic. So this outer part is going to be, this outer part is going to be the fibrous, tough, dense, irregular connective tissue. On the lining of that, between the two would be loose irregular, attaching the two together. And in between that, the lining is going to be the serous, but both of them are parietal, right? So if I put my fist in here, this is the parietal, and on my heart, on my fist, is the visceral. Both of those are making serous fluid, so we call both of those serous. One of our names anyway. So, this would be out here, the fibrous parietal, or parietal fibrous, I don't care which order you put them in. This part with the simple squamous would be the serous parietal. And the whole thing would be the parietal pericardium. Then aligning the inside, we would have the visceral serous. I'm getting too many words here. And to add just another layer of terms, we have a more simple word for that, and that is the epicardium. So I'm going to erase that picture and just draw one line because you got too many words going every which way. Okay. So here's endocardium, simple squamous epithelium plus loose connective, myocardium, visceral serous pericardium where it's attached to the heart, visceral parietal pericardium where it's not attached to the heart, and covering the outside of that, fibrous parietal pericardium. Okay? So I'm going to erase this and just draw this area right here. Okay? So it's not quite as complicated. Unfortunately, the sheep heart that we obtained about 15 years ago, the Federal Ag Department, or whatever it's called, decided that all the sheep hearts needed to be checked for parasites. I don't know who eats sheep hearts, but they lopped off the top of the atria, so we hardly have any superior vena cava or even atria left. And they took off all the parietal pericardium. That was the easiest way to show students what a parietal pericardium actually was. So we'll put myocardium here. And I'm not going to. Okay. Then I'm going to change and use a blue color for the simple squamous. So this is connective tissue. And we'll use blue for our simple squamous epithelium. So that is endocardium. And this would be where the blood is in the heart chamber, okay? Then we have connective tissue attached to the outside of the heart with simple squamous epithelia. And this is our epicardium, if you want to use it in sync with endocardium and myocardium, all right? Also known as the visceral serous pericardium. Now in fourth period, when we talked about perimecium and epimecium, they weren't the same things at all. And now all of a sudden we're using them interchangeably. So I apologize for that confusion of terms. pericardium. And then we add an extra layer of dense irregular connective tissue to make it tougher. And this is our parietal fibrous pericardium. Okay? So let's look at this image here. It might help to clarify. I think this is a beef heart. It's some animal heart because you'll notice that the surgeons are wearing chainmail on their hands, and human surgeons don't bother with that. So I think this is some animal that's getting butchered and trying to save their fingers. So here we have the outer pericardium, the surface that is being gripped here on the outside would be the parietal fibrous pericardium. Okay? Now that that's cut open, we can see the lining. So here I'm touching simple squamous epithelium of the parietal serous pericardium. You with me on that? And then up here, if I go to the top, it's going to flip over and I'm going to come down onto the surface of the heart. And this is the visceral serous pericardium, also known as the epicardium. Okay? Now, remember the plasticized human pelvis when we passed around? We have some plasticized hearts as well. So I'll pass two around. And the pericardium, the parietal pericardium, has been cut and mostly removed. So if you look right up here, this is the fibrous parietal pericardium that you're touching. Try not to get under there and touch the visceral because that starts to lift it up and break it. But it curves under and now I'm touching the visceral serous. Okay? I'm going to pass that around and take a look at them. And here's the other one. Okay. Now, anybody ever heard of the term cardiac tamponade?
You like the fluid then?
Mm-hmm. So cardiac tamponade, we're not talking about a tampon here for visceral fluid, but this occurs when some kind of fluid, either blood or some kind of fluid, fills up more than the 15 mils per normal into the pericardial cavity. So as that increases with blood, what do you think happens to the ability of blood to move into the heart chambers? It's limited, okay? Because it can't expand because it's pushing against that outer fibrous pericardial membrane. So what is going to happen to the volume of blood that goes out of the heart with each contraction? The volume of blood is going to go down, and because each contraction is less volume, what's going to happen to heart rate? It's going to go up. So you have this weak, steady pulse because the heart's trying to beat really fast and maintain a normal cardiac output, but it can't pump out very much with each contraction. Okay? So a couple of incidences, one with IV fluid, one with blood. So Steve Irwin, when he was stabbed by the spine of the manta ray, stingray, that blood leaked, poured into the pericardial cavity. Okay, this can also happen with nail guns. So if you have any idea that a stab wound, whether it be a puncture from a nail gun or a knife, has gone through the heart muscle, you don't want to pull it out. Okay, because then that's already forming like a finger in the dipole, and if you've pull that out, then every time the heart pumps, it's going to pump blood into this space. Okay. The other situation also was fatal. It happened at a hospital about 2 or 3 years before I started working there. A woman who was 6 months pregnant came in with pneumonia and wasn't responding to treatment very well. she had a subclavian line put in. The subclavian veins are quite large under the clavicle, and they can put in a large, either pre-digested feeding or large volumes of blood. And she was getting worse, and they took her into x-ray, and the needle had passed through the subclavian vein and into her pericardial cavity. So the IV fluid was being sent into the pericardial cavity. And unfortunately, they found out too late to save her. Okay, so it doesn't have to be blood, it can be other types of fluids that are filling up. That's the cardiac tamponade. So here the parietal pericardium has been cut and opened up, and you're seeing the visceral pericardium, and here you're seeing the visceral pleura on the lung. There aren't as many open heart surgeries as there are, because a lot of valve replacements, a lot of those are now being done by sending up, I was going to say the machinery, but sending up the equipment through the veins into the heart and doing all the surgeries and cuttings and replacement surgeries and stuff without doing an open chest heart component. All right, question number 2. The heart is found within which of these, and mark all that apply. Okay? So usually when I say that, there's more than one correct answer. I could have phrased this. Which cavity is the heart not in?
It's not A.
It's not E? Yeah. No.
The heart is within. That's why I use the word within.
It's also in the ventral, isn't it? Just the whole.
Okay, one more term on page 10. I knew there was something else I needed to talk about with the cardiac tamponade. Anything that ends in itis means an inflammatory condition. Okay, so appendicitis, gastritis, laryngitis, whatever. So pericarditis is an inflammation of the lining of the pericardial cavity. Normally that serous fluid there is for lubrication. So as the heart expands and contracts, the two surfaces don't rub against each other. All right. If we use pleural fluid, then we breathe. The lung surface rubs against the parietal pleura and creates pain with breathing. So if we lose this fluid, you can imagine, or if we get too much of it and the tissues rub against each other, that causes pericarditis. So I had a colleague, I first started teaching, who was in charge of the chemistry department, and back in Tennessee, and he was young. I think I was 23 and he was probably 25, so he thought he was one of the boys. And every Friday afternoon he would go play soccer with the college guys. Well, one afternoon, he and an opposing player just came chest to chest and hit each other and both fell back. And we're a little bit lost of air, but they recovered, and I don't know who won the game, but he went home. Next morning was the weekend, and he woke up with chest pain. And his dad had some heart issues. So he said, Marcie said, I thought I was having a heart attack. So I decided to get out of bed and do some jumping jacks. And if I was having a heart attack, it would hurt worse. So he said, it kept hurting, but it didn't hurt worse. So I decided to run up and down the stairs in my house. If it was a heart attack, it would hurt worse. Well, that didn't give him any feedback, so he went outside and he ran up and down the hill outside his house. And it still hurt, but it didn't hurt any worse. So he couldn't figure out what was going on. So finally, he drove himself to the emergency room, and they told him to never do that again. He thought he was having a heart attack, to just go, because dying and proving it wasn't going to help him any. But what had happened was when his chest and the other opposing player's chest collided, it did a shearing effect between the visceral and parietal serous components, and scraped them off, and then you had all this excess fluid, And it really wasn't, I mean, it was an inflammatory because of that, and that created an extra fluid response, which is where the pain was, almost like a cardiac tamponade. And they sent him home with antibiotics, just meant it was a closed space, but antibiotics just to make sure that it didn't develop into pericarditis, okay? But pericarditis would be an inflammatory condition of that pericardial cavity, not the heart itself. Myocarditis would be your inflammatory infection of heart muscle. So we're not going to talk more about this than we have already. Myocardium we'll talk about on Monday when we talk about the structure of heart muscle cells. So question 3, we would find simple squamous epithelium, and again the answer's on the board, I think, at least ability to figure it out. Simple squamous epithelium would be found as a component of which of these parts of the heart? And by component, I mean a major component. You could argue that there are blood vessels inside the myocardium and the blood vessels are lined with epithelium, but I'm not thinking of that. So that should give you a hint as far as the answers. Okay, so we saw this one while you were out. So mark all that apply. So there's more than one correct answer. Do you have a question?
Can you go back to the?
Yeah. You done? Or are you still thinking? I'm going to go back to number 3. Okay. Yeah, raise the board.
Yeah. Yeah.
I'm going with B and C on this one.
Myo.
Just my soul.
No. Myocardium is muscle.
Okay, I'm just going to introduce you to the chambers of the heart, and then it'll be time for a break. It's a little early right now. So I'm on page 14 of your lecture note.
Squamous epithelial same
Oh, the black dots, right?
Yes.
The black dots.
So the E.
So do you remember how early on in discussion I qualified the function of the chambers? We have 4 chambers in the heart. We have 2 receiving chambers and 2 pumping chambers. All right, kind of similar to the 2 vessels. When we have the 2 vessels fused together, we had 2 vessels coming in and 2 vessels leaving. Okay, so we have 2 receiving chambers and 2 pumping chambers. And you have a good diagram on page 14. This one. And I never can seem to duplicate, I always get in trouble up here. But on the right side of the heart, the right side is our deoxygenated blood side. Okay, not unoxygenated, because it has about 40% oxygen down from 100. So it's receiving blood from the upper portion of the body, upper limbs, and head and neck, and from the lower. And by gravitational force, that blood is flowing into the right ventricle. Okay? So our 2 receiving chambers are the right atrium, which is deoxygenated blood, I drew it in blue, and the left atrium. Okay, so if I can draw the left one, here, let me finish drawing the pumping chambers. coronal section. All right, so this is the right atrium. And this is part of the left. Remember, most of the left is actually behind the heart. So we're seeing just a little bit of that
And then the oxygenated blood comes back through
auricle
the
structure.
to the left atrium.
So let me move the right atrium over to here where I have more room to write.
Epithelial lining. This is the myocardium. So the epithelial line will be over here.
And
Pericardium is
find these structures on the parts that you have on your lab table.
the epithelial line will be over here. And
So let's look at the right atrium first. The right atrium, again, both of these are receiving chambers, all right? So this is going to receive blood, and it's receiving deoxygenated blood, all right? So it's receiving blood that has passed through capillaries of tissues. It's receiving blood from the superior vena cava. And this is going to be from the head, upper limbs, and chest, okay? We'll learn that again when we look at blood vessels. Then it's receiving blood from the inferior vena cava. And only about an inch of the inferior vena cava is above the diaphragm. So all the blood flowing to the heart from the inferior vena cava is coming from the lower limbs, pelvis, and abdomen. The lower limbs, pelvis, and abdomen. Right? There's actually a third vessel. Part of the chest structure doesn't send its venous blood through the superior vena cava, but through something else. Through another relatively large vessel. Look just on the inferior aspect of the left atrium. See this large vein? It dilates, and it's going to empty into the right atrium. Down here near the inferior vena cava, this large red, actually not, yeah, this large red opening there, although it should be a dark, dark red because it's deoxygenated blood, not blue, but dark, dark red. So this is carrying venous blood from the heart, because the heart obviously is using up a lot of oxygen, and it has its own special vessel. So this is going to come in right about here. And that is known as the coronary sinus. So the coronary sinus is returning deoxygenated blood from the heart itself. So those are the three vessels that empty into the right atrium. Superior vena cava, inferior vena cava, and coronary sinus. And we'll find this on the sheet parts. We might not be able to see superior vena cava. We can find the coronary sinus. Okay, remember, deoxygenated blood. So it's under low pressure, and it's coming back from the heart. And we call those vessels veins. Not because they're carrying deoxygenated blood, but because they're carrying blood to the heart. All right? So blood flow is in this direction. Then we have these vessels over here. And two coming from the right side of the body as well. And these are going to empty into the left atrium. So if you look at the posterior view of your heart, not your very own heart, but the model. Here's the left atrium. See these two vessels here that are red? And over here are two vessels that are red? They're carrying oxygenated blood. But these vessels are identified as veins. So it's a unique situation where we have veins carrying oxygenated blood. So these are known as the pulmonary veins. Oxygenated blood because they're coming back from the lungs. Veins because they're coming back to the heart, which means they're under low pressure. So veins have less smooth muscle, okay? Because they're under low pressure, they have a distinctive structural component. So we're calling them veins based on their structure rather than their content. Okay? The last thing I'm going to leave you with before we take a break, then we'll come back into the ventricles, is most of the blood coming from the fetus, and we'll do fetal circulation separately with the veins, is coming from the liver, which is coming from the umbilical vein, which is coming from the placenta, which got its oxygen and nutrients from the mother. So in the fetus, this is mostly oxygenated blood. Does it have any need to get pumped to the lungs? No. But the lungs do need some of this because it's oxygenated and nutrient rich. And so most of this blood is going to bypass the lungs, headed over to the left atrium. And it does so through an opening. This is the one we were mentioning earlier. It does so through an opening that is easier to see on the right side, but is present on the left side as well. This closes within 2 to 3 days after birth, all right? So when it's closed, when it's open, it's called the foramen ovale. And when it's closed, it's called the fossa ovalis, all right? So in the postnatal, this would be the fossa ovalis. What happens is as the heart muscle tissue grows, part of the wall separating the right and the left atrium grows down from the upper surface. Part of it grows up from the lower region, and we have this overlapping. So the force of the blood coming in from the inferior vena cava goes over from the right atrium to the left atrium. And it's this overlapping opening that is the foramen ovale. After birth, when the baby takes its first breath, and air fills the lungs, the pressure in the lungs drops precipitously, okay? And now it's easier for the blood to be pumped to the lungs than to go into the left atrium. So over the next couple of days, connective tissue develops and fuses those two flaps together. And so it goes from foramen ovale, which we'll talk about in a couple weeks, to the fossa ovalis. So on your models, in this one, the fossa ovalis is this white structure here called number 55. That's the fossa ovalis. And then the larger ones, these almost have too much material on them. It's number 81. Okay. On those plasticized hearts going around, you can actually see it. If you take the larger half of the heart and hold it up to the light, you can see an oval thin region in the wall between the right atrium and the left atrium. Okay. On the sheep heart, sometimes you can feel it, but it's nearly impossible to see.
You said when open, it's called ovalis?
The fossa ovalis is closed. Foramen ovale is open. This is a diagram from Netter's. So here, the auricle has been cut open. I'll come back to that in a moment. Notice how smooth the rest of the atria is, all right? The only rough part that we see is in the auricle. So if you open up the right auricle, that's the flap, like an ear flap, you'll see these ridges of muscle. And in the left auricle as well. All right, those ridges of muscle are present in both the right and the left and are identified, I'm not gonna draw it here because we don't have the oracles, but they're identified as pectinate muscle. They're only found in the oracles. And they really don't contribute anything to the function. But they are something that I want you to recognize as being components of the atria, okay? And this is the pectinate muscle here. So inferior vena cava, superior vena cava, know how they form a straight line, up and down, okay? Here is the coronary sinus, the opening for the coronary sinus. And here's the fossa ovalis. Okay? So we'll stop there, take a break, and come back at